At any point during the year, you will be in one of three phases when it comes to your health insurance. The first phase is what we call the deductible phase. In this phase, you have not met your deductible, so you are responsible for those costs yourself. So whatever your bill comes out to, you would be responsible to pay 100% of that bill while you're in phase one. Now remember, you may have some services where a deductible does not apply. So in that case, you would get to move right into phase two for those services only. Phase two is what we call our cost sharing phase. In this phase, you have met your deductible, but you have not met your out-of-pocket max. So here you're going to pay your co-pays or your co-insurance while your health insurance covers the rest of that bill. So you pay a portion, health insurance pays a portion. Once you reach your out-of-pocket max, you move into phase three, which is your covered phase. Here, since your out-of-pocket max has been met, your health insurance is going to pick up 100% of the bill until the calendar year is over. So remember, these phases reset every calendar year. Once January 1st hits, you move back into phase one. Also remember that this would only apply to covered benefits under your plan. So if there are services that you want that your health insurance plan doesn't cover, you would still be responsible for 100% of those costs. Your health insurance wouldn't pick up any of the bill for non-covered services. Let's look at an example to see how this works. Let's say you have a health plan that has a $300 deductible and a $3,000 out-of-pocket max. In your health insurance plan, primary care services do not have a deductible. No deductible applies. So for your primary care services, you jump right into phase two, into your cost sharing phase. Let's say right out of the gate, January 1st, you have to go see your primary care doctor. You only have to pay your copay. So you pay $20 and your health insurance plan covers the rest of that bill, which is $80. So you move right into your cost sharing phase because no deductible applies for those services. Let's say after that you have to go to a specialist. That specialist bill is $200. Because you have not yet met your deductible for those services, you are going to be responsible for 100% of those costs. Let's say while you're at the specialist, they do a test that costs $100. Again, since you haven't met your deductible yet, you have to pay that full bill. Now you've met your deductible. So for the rest of the year, you'll be in your cost sharing phase until you meet that out-of-pocket max. Okay, let's say you go to the hospital, that hospital bill is $4,000. You have to pay 20% co-insurance for that bill. So you're paying $800, your health insurance plan is covering the remainder of that bill, you're sharing that cost with your plan. After that, you go back to your primary care doctor, you're gonna still be in your cost sharing, so you pay $20, and then your health insurance plan pays the rest, the remainder of that $80. If this was all of the care you received that year, you would never move into phase three because you still haven't met that $3,000 out-of-pocket max. January 1st of the following year, this all resets. So you would move back into phase one and you would have to meet your deductible again to move into your cost sharing phase.